Good morning. I am going to let folks come in. Alrighty, I see a few. We're letting folks in. Awesome. I think we're at a quorum. Alrighty. Good morning. Thank you for everyone for joining us this morning. Today, we are joined by patient and physician storytellers from across Texas to highlight how Trump era and Republican-led attacks on abortion access are harming Texas families. Today's event will set the record straight on what's at stake as Governor Abbott, President Trump, and extremist Republican lawmakers work to roll back access to reproductive health care even further. Right now, Texans are living under three reproductive health care bans, each causing devastating harm to women and families statewide. As Texas lawmakers push forward to enact their anti-abortion, anti-democratic agenda, today is a great opportunity to raise awareness of the deadly impact of abortion bans and the continued efforts by extremist Republicans to harm women and patients seeking life-saving medical care. Abortion bans kill women, and yet lawmakers at the local and federal level are continuing to weaponize the government with an extremist agenda to attack reproductive freedom for political points. With that being said, Free and Justice is honored to introduce Democratic Whip for in the U.S. House of Representatives, Katherine Clark. Representative Clark has proudly represented in Massachusetts' vibrant 5th District since 2013. In the fall of 2022, she was elected by her colleagues to serve as Democratic Whip, the second most senior position in the House Democratic Caucus. Currently, she is the highest ranking woman in Congress. Previously, Clark served as Assistant Speaker of the House, as Vice Chair of the House Democratic Caucus, and as a senior member of the House Appropriations Committee. From the school board to Capitol Hill, Clark's public service has been fueled by a passion for lifting women and families. She is a leading proponent for ending wage discrimination, safeguarding access to abortion, ending gun violence, improving access to affordable care, quality childcare, and guaranteeing paid leave. With all of that being said, I will pass the mic to Congresswoman Clark.
Amazing. Thank you so much for having me. I am so glad to be here with all of you. And thank you to Free and Just for bringing us together today. And to the storytellers, the power of your stories is what is going to continue to fuel this fight and our cause for freedom. So for 3 years, we have witnessed Texas Republicans dehumanizing their own residents. For 3 years, they have criminalized doctors for doing their jobs. And for 3 years, they have tried to ban mifepristone. For 3 years, they have systematically enforced state-mandated pregnancy. Texas is ground zero in a nationwide crusade on the basic freedoms of the American people and American women. A crusade that has wreaked havoc and terror on millions of people. These right-wing extremists have blood on their hands, and they are proud of it. They have turned communities into healthcare deserts. They have turned the heartbreak of a miscarriage into a potential death sentence, and they have rolled maternal health care back to a previous century. In states with abortion bans, infant mortality has risen by 6%. Among Black babies, it has risen by a heartbreaking 11%. Pregnant women are dying from treatable conditions. These bans are killing innocent people. So 3 years in, what are Republicans doing now? In Washington, we are watching them double down. They're dismantling Medicaid, the program that pays for 41% of births in this country. They're making it even harder to survive as a parent, taking food off the table, raising prices, cutting childcare, defunding schools. And in Texas, they are covering up the deaths they have caused. The Maternal Mortality Committee chose not to conduct investigations into the first 2 years after Dobbs. No need to review or report any of those deaths. Meanwhile, Texas Republicans want to pass another abortion ban. These extremists believe that people's health, our well-being, even our survival, all of it is secondary. What comes first is an ideology of control, absolute control over if, when, and how to start a family. I can tell you from traveling across this country that people are fighting back. We're fighting to save lives. We're fighting for our fundamental right to safety and dignity and autonomy. And it is an honor to be here with you today and to turn the floor over to one of the most courageous advocates leading that fight, Dakota Ray Frosto.
Thank you so much, Congresswoman Clark. I'm Dakota Ray. I am a full spectrum doula and abortion storyteller here in San Antonio, Texas. And 6 months after SB 8 went into effect, I discovered that I was 8 weeks pregnant. And with my 38-day long menstrual cycle, SB 8 essentially gave me 4 whole days to suspect I was pregnant, test positive, schedule an appointment, gather the resources, and get an abortion. And despite taking every step I could as a teenager to be proactive about my reproductive health and being in no position to navigate pregnancy or parenthood, I was forced to schedule an appointment a month out and travel over 700 miles or 11 hours from San Antonio, Texas to Albuquerque, New Mexico to access an abortion. My 2-day trip cost almost $2,000, an abrupt expense most Americans cannot afford, yet still a minuscule investment in comparison to pregnancy and parenthood. The adamant stigma, coupled with legal repercussions, made me question who I could trust and who I was willing to endanger. Navigating abortion access in Texas is isolating and overwhelming by design. When I first entered the clinic, I received a news notification on my phone announcing that Oklahoma, a state I had almost went to instead of New Mexico, had just enacted an abortion ban that morning. A state I could have made the same journey to and spent the same amount of money on, only to step into the clinic and be denied access to a procedure because of the zip code I was in. That New Mexico waiting room was filled with Texans of all ages who had traveled to access abortions, minors who traveled without their parents, and mothers who traveled without their children. Texas did not care that I was passing out daily from dehydration and malnutrition. They did not care that the 15-year-old next to me in the waiting room was missing school and in a state she had never been to before. They do not care that majority of my doula patients are children and mothers grieving their babies, and they will not care when people miscarry or experience a heartbreaking fetal anomaly. To complacent politicians, we are nothing more than numbers aiding and abetting criminal activity. We are not patients, friends, mothers, or daughters. My abortion saved my life. It opened doors. It allowed me to invest in my community and myself and recognize the power an individual can have. And this is exactly why Texas is relentless in its attacks on all forms of reproductive justice. Pregnancy should not be a death sentence, and abortion should not be a prison sentence. Texans deserve to have a say in how they have children, don't have children, and raise the children they have in safe, sustainable environments. In a state that claims to value autonomy and freedom, Texas has made it abundantly clear that this does not apply if you are not willing to capitulate to neo-fascist policies. Despite anti-abortion rhetoric attempting to paint abortion patients as irresponsible, the largest contributing factor to my unintended pregnancy was not my presumed irresponsibility, but rather the negligent policies of my state and country. Rather than investing in evidence-based policies to reduce unintended pregnancy rates, the Texas legislature has cut family planning program funding, invested in inadequate sexual education, and restricted contraceptive access. Rather than advocating for evidence-based policies that address the concerns of pregnant people, Congress continues to enforce an unlivable minimum wage, inadequate maternal leave, and unregulated prescription drug prices. Abortion is not a separate issue from redistricting or gun violence or our bathroom bills. Abortion bans and restrictions are calculated and insidious attempts to further dehumanize, disempower, and subjugate Texans. Because abortion is not just health care, it is freedom. And with that, I will pass it to Holly Cunningham. Thank you.
Thank you, Dakota Ray. Good morning. My name is Holly Cunningham. First, I want to thank Free and Just for hosting this event, and I want to thank Congresswomen Katherine Clark and Senator Wendy Davis for their continued fight for women here in Texas and across the country. I am also deeply honored to stand alongside the women who are courageously sharing their stories today. I am here because Texas law forced me to flee my home state, not once, but twice in 1 year, to receive abortion care that was medically necessary. I worry every day that more women in Texas will suffer or even die because of the extreme abortion bans that politicians have forced upon us. Like so many mothers, I was overjoyed to learn I was pregnant. In late 2022, my husband and I began preparing to welcome our first daughter, Ellie Grace, a baby sister for our 2 boys. But in January of 2023, at my 20-week anatomy sonogram, our excitement turned to devastation. My doctor told us that our baby had anencephaly, a fatal condition where the brain and skull never fully develop. In that moment, I wanted to know what came next. Instead, my doctor lowered his eyes and said, "With the laws in Texas, I'm sorry, I can't tell you what you can or can't do." I was forced to travel to New Mexico to receive the care I desperately needed. No mother should ever have to leave their home, their doctor, or their support system in a moment of such grief and heartbreak. Afterward, I sank into depression. My daughter was gone, my arms were empty, and I was too afraid to even go to the grocery store for fear someone would ask about my pregnancy. Unimaginably, it happened to me again. When I became pregnant with my second daughter, Lily Grace, we learned that she also had anencephaly. My doctor had never seen this happen twice in one patient before. And again, I had to leave Texas to receive basic medical care. I cannot put into words the agony of living through this nightmare twice, knowing all the while that my state was abandoning me. I deserve better. My family deserved better. Texas women deserve better. And it breaks my heart knowing that so many families are enduring this same pain, some without the resources, support, or ability to leave the state. Since SB 8, since the Supreme Court's cruel Dobbs decision, and since Texas' sugar ban, dozens of women like me have been denied the care they need in the face of dangerous, life-threatening pregnancies. Texas has become one of the most dangerous places in the country to be pregnant. Lawmakers have heard our stories, they've seen our tears, and still chosen to do nothing. Instead, they double down on the extremist agenda that puts politics over people and threatens to criminalize loving partners like my husband, a combat veteran who fought for our freedom, while our state takes that freedom away from us. This is not compassion. This is cruelty. What is happening in Texas is wrong. No woman should ever be forced to suffer or risk her life because of an extreme political agenda. The fear, pain, and abandonment I felt will stay with me forever. But I will not stop speaking out. My hope is that by sharing my story and by standing together, we can make change. We can restore reproductive freedom, not only for Texas women, but for women across this country. Thank you for giving me the opportunity to speak, and thank you to the women on this call who, like me, know what it means to endure the impossible. I stand with you, and I hold on to hope that despite the efforts of the Texas legislature and administration, we will one day reclaim our autonomy, the simple human right to make decisions about our bodies and our own families. I am now honored to pass it over to Dr. Beasley.
Thank you. And thank you, Dakota Ray and Holly, for sharing your stories. My name is Dr. Anitra Beasley, and I am an obstetrician gynecologist. As the mother of 3 wonderful children, I know how beautiful and special pregnancy and motherhood can be. However, as a doctor, I also know that pregnancy is not without risks. Patients can develop life-threatening high blood pressure or heavy bleeding. Their bag of water may break, putting them at risk for infection or other complications. These complications can happen at all stages of pregnancy, including when it is too early for the baby to survive. I know this because these exact situations have happened to the patients that I treat. Abortion restrictions rob people of choice and make my job harder to do. I became a doctor because I want to help people, not harm people. When complications like preeclampsia or PPROM happen, patients are often shocked. They want to know what is happening, what will happen, and what I recommend. It is not what they expected. And then we have hard conversations. I tell them about preeclampsia or PPROM or abruption. I tell them about what will happen if the pregnancy continues, the risk to their health now and in the future, and the risk to their pregnancy, and very often how their baby will not survive. What I should be able to do next is tell them about the induction or procedural abortion and help them decide what is best for them and their family and their pregnancy. However, with our current abortion bans, patients may be forced to remain pregnant in spite of significant risk to their health. We should not have to wait for the situation to become more dire, for infection to set in, or for her blood pressure to no longer be controllable with medications. This is not what we do for any other healthcare condition. We do not wait for people to get sick. We do not wait for the condition to worsen before we intervene. That would be ridiculous, and no one would stand for that. Medical school, residency, and fellowship, and over a decade and a half of practice has prepared me to take care of pregnant patients. The same cannot be said for those who have put these harmful laws into place. Texas has a rising maternal morbidity and mortality rate with disproportionate impacts on people who look like me. Abortion restrictions do not help. They do not help patients who have very wanted but very complicated pregnancies. They also do not help patients who are pregnant and just know they can't be for whatever reason that is. During SB 8, it was heart-wrenching to tell people that they could not have an abortion because there was cardiac activity in their 5-week pregnancy. To walk out of the room and hear a patient that had been so stoic during the appointment sobbing because they know that they could not get out of state and would have to continue the pregnancy. Now, post-Dobbs, these patients are often unseen and left out of conversations, but they should not be forgotten. I stay here practicing in Texas because I am a Texan, and my fellow Texans need a good doctor and good health care. But it is hard. It is hard to be constrained by harmful laws that do not help women. We should be doing everything in our power to help women lead healthy lives, have healthy pregnancies, and have healthy outcomes. What we need is comprehensive reproductive health care, not more abortion bans. Thank you, and I pass the mic to Caitlin Cash.
Hi, everyone. Thank you so much for being here today. I'm here to speak, and I just want to focus on one thing, and that is how this legislature is ramming through yet another abortion ban, the 4th in Texas, and it is doing it in ways that shut Texans out of the democratic process. Let's start with SB 7. The second special session was gavelled in at 12 p.m. on August 15th, and by 9:34 that same night, just 9 hours later, the bill had been filed, read, referred to the Senate State Affairs Committee, the rules were suspended, a hearing was held, a vote was taken, and the committee report was printed and distributed. So unless you happened to be standing inside of the Capitol that afternoon, there was no way for the public to participate. SB 7 was jammed through the process and sent to the Senate floor in a single evening. Then we have the House version, HB 7. It was filed late on August 20th, referred to State Affairs at 6:32 p.m., and then scheduled for a public hearing just 36 hours later at 8 a.m. on August 22nd. The committee then capped that hearing to just 2 hours. 2 hours for a bill, if passed, will impact the healthcare of more than half of all Texans. And here's what that committee looked like, that hearing looked like. 441 people registered on the bill. Of that, 26 were for, 413 against, and 2 were neutral. 82 signed up to testify, but because of that time limit, only 30 were allowed to speak, leaving more than 50 Texans silenced despite the time that it took to be there. The testimony process was skewed from the start. Of the 30 called, 17 spoke in support of the bill, while only 12 were allowed to speak against it. 5 of the 17 in favor of the bill were from Texas Right to Life, while only 1 opposing organization was called. It's also important to note who registered against the bill. The Texas Medical Association, the Texas Hospital Association, Texans for Life, Texas Alliance for Life, the Texas Conference of Catholic Bishops, and Texas Impact. That is extraordinary. Even groups that normally oppose abortion stood alongside major professional associations, hospitals, doctors, and faith communities in opposing HB 7. And yet, despite this overwhelming opposition, the bill is expected to be voted out of committee today and could be on the House floor as early as Wednesday. So let's be clear, this is not democracy. This is lawmakers ramming through a 4th abortion ban at lightning speed during a session that was supposed to be about flood relief. Instead of helping families recover, instead of listening to Texans, the legislature has spent this session redrawing congressional maps to protect their power and now advancing another cruel abortion ban. And I want to ask why. Why are Congressman Leach and Speaker Burrows so fixated on a bill that would turn women's healthcare system into a bounty hunting, a culture of surveillance, suppression, cruelty, and state-sanctioned suffering? Why is Speaker Burrows advancing legislation that only benefits Jonathan Mitchell, a lawyer who doesn't even live here? As a Texan with firsthand experience of what happens when men hastily pass laws about medical care, I am terrified at the thought of what healthcare will look like if this bill passes. When my baby was diagnosed with a lethal fatal anomaly, I was sent home with my medical records and told to figure it out. I was then treated like a criminal for trying to access the medication that this bill targets for a subsequent miscarriage. And then I nearly died in childbirth because I needed a D&C, a procedure that is constantly caught up in these bans. But I didn't need a D&C for an abortion. My baby was safely in my husband's arms. I needed a D&C for a retained placenta. And instead, my care was delayed for nearly 2 hours, and I spent the night in the ICU fighting for my life. That is what it looks like to live in Texas under our existing 3 abortion bans. And I have to ask, what will it look like under a 4th? Thank you. And with that, I am honored to turn it over to one of my heroes, Wendy Davis.
Caitlin, thank you so much for your powerful words. Thank you to the other storytellers who shared your powerful stories. As many times as I hear the tragedies that you all have shared today, I still cannot be helped but be moved, angered, saddened, frustrated. And I know you feel the same way. We've been fighting this battle in Texas for such a long time. And thank you to Free and Just for making sure that we continue to remind members of the public and of the press what's at stake here, the very real human consequences of these laws and what they mean in our lives. I was thinking about it this morning, about the fact that this issue tends to rise up into public consciousness for a short time, and then it goes away. And it's up to all of us in the midst of the noise that is happening from redistricting to the trampling of our democratic rights and principles. It's up to us to make sure that we keep this issue front and center in the minds of legislators, in the minds of the public, and certainly in the minds of people who vote in this state and elsewhere about exactly what the stakes are when we are talking about these incredible impingements on our reproductive freedoms, our choices, our bodies, and our lives, honestly. We've all been fighting this battle in Texas for a long time. And we hear so many stories about what the tragic consequences of these laws have been. And for everyone who has shared their story publicly, whether today or at another period of time, there are countless others who have suffered the consequences of what these laws have meant in their lives, who we'll never know, we'll never hear from, but who are there, real, on the ground, understanding in a very personal way what laws like this mean. Unfortunately, Texas tends to be ground zero for the passage, excuse me, of these impingements on our constitutional freedoms, and also, unfortunately, tends to write the playbook for so many other states. We see that not only in abortion bans, on the restriction of abortion medication, the fight to try to restrict that medication and its use all over the country. But we're also seeing it with the dramatic defunding of reproductive health care. While we're talking about what might happen because of defunding at the national level, and of course, there is a big court fight underway right now to keep Planned Parenthood health centers in this country allowed to participate in the Medicaid program and in Title X. In Texas, for more than 10 years, we have not had the ability for Planned Parenthood health centers to receive Title X money, no Medicaid reimbursement money, no breast and cervical cancer screen reimbursement money, no sexually transmitted infection, disease and diagnosis and treatment money, none of it. And what that means in our state is that at a time when our ability to access abortion care has been completely banned, we cannot access the means that help us actually to control our own bodies and to determine when and whether we get pregnant in the first place. In fact, because Planned Parenthood health centers are down now more than $200 million per year in federal funding in Texas from what they were once giving, there was a report that came out recently that demonstrated that contraceptive care access in Texas has fallen in the last 10 years by 56%. So think about what this means cumulatively when we are denying women the ability to control our own reproductive choices, when we are denying women the ability to control our own health, our lives, and our ability, of course, to pursue becoming parents one day as we choose to do, and to live the life that we all deserve. These constraints upon constraints upon constraints are creating an absolute traumatic, dramatically terrible situation in the lives of women in our state. And it will continue to have consequences. Thank you so much for being a part of this. Thank you for your willingness to uplift these experiences and these stories. And let's all remember what we're fighting for here. We're fighting for ourselves. We're fighting for each other. We're fighting for women we have never met and will never know, because we understand all too much what the consequences of laws like this mean in our lives. And we're never going to stop fighting until we make sure that these rights are restored. Thank you very much.
Thank you so much, Senator Davis, for those remarks, and thank you to all of the speakers today for telling your stories and uplifting the need to defend reproductive freedom in Texas and across the country. I am now going to switch the view for our audience to gallery, and our storytellers are here. If anybody in the press would like to ask any questions for Q&A. And so, yeah, I open the floor to anybody in the press who have any questions for any of our storytellers. I also want to flag to all of those attending today that our storytellers were brave enough to drop their individual stories into the chat function. If there are any of those stories that you would like to connect with any of the storytellers afterward, after the event, Free and Just is happy to facilitate that as well as any of our other guests who are on today. But I want to open the floor just a few more moments in case anybody has any questions.
And this is Kelly with Free and Just. If you are joining us as a reporter on this call and you have a question for any of the folks who have participated today, you can either raise your hand in Zoom to come off mute, or you can pop any questions for folks into the chat function at the bottom of your screen, and we can facilitate questions there. But again, if you'd like to ask questions, feel free to raise your hand in Zoom to be taken off mute, or you can use the chat function at the bottom of the screen to submit those questions, and we will direct them appropriately.
Seeing none, I welcome anybody who has attended today to reach out to myself or Kelly directly. I want to thank everyone again for joining us today for this event to mark the anniversaries of these abortion bans here in Texas. I want to thank all of you individually, and please let me know if you have any questions. And with that being said, I adjourn. Have a good one, everyone.